Hi guys, welcome back to another video of Doc Talk. I'm Dr. Nirmal and the topic of discussion we are going to do today is MDMS versus DNB. Now this is a very I say prominent topic. Most of the students who give NEET PG have to come go through this question that whether they should choose MDMS or they should choose DNB. So I'm here to help you a little on this topic. So let's start. Now, if we talk about MDMS and versus DNB, so I have of course given it separately and kind of a I said difference kind of a pattern here. So let's see what is DNB and MDMS. Now MDMS is basically Doctor of Medicine and Master of Surgery, whereas DNB is a Diplomat of National Board. No, DNB is not a diploma. Okay, diploma is different. This is Diplomat of National Board called as DNB. Now where it can be done. Now if we say done in government and private medical colleges, so basically MDMS is done only in the medical colleges, be it government or private, whereas the DNB is done in the corporate as well as civil hospitals of the country. Now by corporate hospitals there are a lot of corporate hospitals, you can say like Medanta, Narayana or the Fortis or Max. इन सब कॉर्पोरेट हॉस्पिटल्स में डीएनबी करवाई जाती है एंड एज वेल एज सिविल हॉस्पिटल्स, फॉर एग्जांपल सिविल हॉस्पिटल सेक्टर 16 चंडीगढ़ और सेक्टर 6 पंचकुला. ओके, सो इन हॉस्पिटल्स में करवाई जाती है for DNB. Okay, and the MD and MS is of course is done in medical college, be it government or private colleges. Then what is the aspect of theory? In theory you can say five plus will be there in the MDMS. There will be a lot of theoretical things that you will run, and if we come to practical you can take only 3 plus, even 4 plus will be justified. Okay, in practical aspect, because Handson is very good in the government institutes, but if you come to private institutes, the Handson is very less compared to the government. But if we compare MDMS to the DNB, the practical aspect of DNB and MDMS is almost similar if we take the average. Now if we do the DNB, the theoretical aspect is very less, as there will be very less teaching to you, but the practical aspect is way better than theoretical approach in DNB. So that's it, DNB. Then if we come to the techniques, the old techniques and the equipments will you will see in the government colleges and some of the private colleges. If you do MDMS, you will see that a lot of old techniques and equipments are being used in the government sector, whereas if we come to the DNB, as most of the corporate hospitals use the latest technologies, there will be latest techniques and the equipments provided to you that you can learn. For example, in the government hospital you will learn the laparotomy more, and in the I say DNB institutes you will laparoscopy more. Okay, so there will be laparotomy in the government and there will be laparoscopy. I'm not just I say superimposing in all the institutes, but this is just most of the institutes will provide you laparotomy versus laparoscopy. So okay, so that's is old technique versus latest techniques. Then if we come to the teaching aspect, you will see that in the MDMS you teach and you get taught. Okay, you teach your juniors, be it interns, be it old final students or new final students or second year students of the MBBS. You teach them and you get taught by your seniors, be it JR2, JR3 or senior residents. Okay, so there is a teaching process going on. That's why I have said this is a very theoretical process to do MDMS in the medical colleges. Whereas if we come to the DNB, only a very less teaching is to be taken. Nobody bothers about the theoretical aspect. All you have to gain is the practical knowledge. So there will be very less teaching in the DNB institutes. Then if we come to the okay, how you can take up the seats, you need a very good rank. I say higher rank than DNB to get into MDMS colleges, because the availability of the seats is of course on the high rank side. Whereas in the DNB, if we compare to the DNB and MDMS, the DNB seats are relatively lower ranks for the same branch. For example, if we want general medicine in the MDMS, okay, we need MD general medicine, the minimum rank we should have is 4,000 5,000. Whereas if we need MD general medicine, DNB general medicine in a good corporate hospital, it can go up to 7,000 8,000. Okay, that's the difference. Okay, that the relatively lower ranks can take the same branch in the DNB. Then if we come to the enjoyment part, yeah, in the MDMS, as you are in the medical colleges, you will relive your college life. There will be hostels, there will be mess, there will be playgrounds, there will be college fests that you will relive. Okay, so that's something which is lacking in the DNB, because there will be no college and there will be no college life. So if you want to relive your college life, MDMS is a good option. Then there is a thing called as thesis presentation as well as poster presentation, which is to be done in the MDMS institutes, medical colleges, whereas in the DNB there is no such thing as no thesis and poster presentation. You don't have to present anything and to attend any seminar for the same, or you have to write the thesis for the university. There is no such thing for that in the DNB. Okay, then if we say the government institutes specifically are less professional as compared to DNB institutes. Okay, the government medical colleges, of course, are less professional as compared to the DNB institutes. Of course, there is a corporate hospital and there is a government hospital. More professionalism will be seen in the corporate hospitals, of course, in the DNB. Then a very big setback for which most of the students do not choose DNB is the low passing rate. I say very low passing rate. I'll be giving some examples here. And if we come to MDMS, there will be a very high passing rate. Okay, a lot of students, there is very unlikely chance that you will fail in your MDMS exam if you have prepared well. But in DNB, you can fail even if you have prepared well. So let's see some examples why. Like if we compare ENT last year to this year, there is only 34% passing percentage of the students. So you can see only less than 50% students pass in DNB ENT exam. Then if we come to the ortho, less than 18%, only 18% students pass their DNB professional exam, which is very, very less. Okay, if we say 100 ortho students took the exam, only 18 got pass. Not even 1/4 of the students get pass in the DNB ortho exam. Then if we come to the pathology, again 35% students is the passing percentage, which is again less than the last year passing percentage. But if we come to the pediatrics, it's 36%, which is a little more than the last year percentage, the last exam percentage, I say. And if we come to the anesthesia, it is 42.4%, which is again less than the last exam percentage. If we come to the eye, it's 65.3%, though the percentage is good, but it's still less than the last exam percentage. Then if we come to the radio diagnosis, the percentage is 67, again, which is less than the last exam percentage. But if we come to the general surgery, it's 68.2, which is a good percentage. More than 50% students are getting passed, but still it is less than the last exam percentage. Then if we come to the general medicine, the exam percentage is 73.1%. The student passed the exam, which is more than the last exam percentage. And if we come to the obs gynae, which has the highest passing percentage, which is 89.9%. So if you are taking DNB obs and gynae, it's very unlikely that you will fail the exam. But if you are taking branches like ortho, or I say ENT, pathology, pediatrics, there is a very more than 50% chance that you will be failing the exam. That's why a lot of students do not take DNB, because of the very low passing rate. But this is something you can cope up with. Okay, so there are a lot of reasons that you should take the DNB, but let's see why there is a very low passing rate. Now if we say that the MDMS exams is to be conducted by the state universities, and there is a theory plus practical pattern. Okay, so there is a theoretical exam which you have to write, which is of course subjective exam. Then you have to give the practical in your college only, where internals are your professors and externals comes from outside. So basically there is 50% of exposure to your known people and 50% exposure to the strangers, the externals. But if we come to DNB, there is 100% exposure to strangers. The exam is not conducted by any state university. It is conducted by the NBE itself, and it's a OSCE method, we say, which is also used in PLAB too. An OSCE method is used, as well as a theoretical exam is being taken. So basically that's why there is a very low passing rate in DNB, because the examiners are totally strangers to you and there is no help coming from their side. Okay, so this is one of the biggest reason that's why DNB people fail in their exams, as well as there is very less theoretical approach in their professional years. Okay, so basically this is the reason why most of the people choose MD versus MS, MDMS over DNB. Now there is one more thing, that's why people choose MDMS over DNB, that is they will be getting more priority even in the hospitals as well as medical colleges, be it corporate hospitals, be it any government hospital or medical colleges. The MDMS is being given a priority over the DNBs, and this is a rule. Okay, you will see this is, call it stigma or whatever, but this is something which is practical enough to be seen. If you see, most of the hospitals will have MDMS as well as DNB, but the priority, if there is a one general medicine from a good college, and then there is a general medicine, a DNB, of course from a good corporate hospital, there is a very good chance that the MDMS will be taken, MD general medicine from a good college will be taken. Okay, and the DNB will be rejected. Okay, so I'm not saying that DNB is I say less important than MDMS. It's just the stigma or the practical thing you will see in the hospitals. Okay, then comes the main thing, that there will be a lot of hands-on training. If you are going for a surgical branch, you know hands-on is very important. There will be a lot of hands-on training in the government institutes. Then there will be private medical colleges. Okay, now government medical colleges give a lot of hands-on to your surgical post graduations as well as the ortho and other branches, be it MSENT, ophthalmology, which are MS branches. A lot of hands-on will be there, whereas in the DNB you have to select the institute accordingly whether they give you hands-on or not. Okay, because in 3 years, if you are doing DNB general surgery in a good institute but they don't let you touch the patient, okay, then how will you do the surgeries? That's the thing. If there are very less hands-on, then how will you learn? That's why a lot of people choose MS in the medical colleges and MD in the DNBs, good DNBs. Okay, so this is some a good criteria to define that whether to choose in the MD versus DNB. So let's see again the MDMS thing, that the MDMS is done in government and private medical colleges, whereas DNB is done in corporate and civil hospitals. There is more theory and practical in the MDMS, whereas less theory and practical in the DNB. There is all techniques used and equipments used in government medical colleges, whereas a very good latest techniques will be used in the DNB institutes. There will be very less teaching in the DNB, but there will be a thing called you teach, you get taught in the medical colleges. There will be very high rank needed to get into MDMS in a good medical college, but comparatively low rank can get you a seat in the DNB institutes. There is a very good college life. You will see a lot of things in like fest and the sports events in the medical colleges, whereas no such thing will happen in the corporate institutes, be it DNB institutes basically. So there will be no thesis and poster presentation in the, I say, DNB institutes, whereas thesis and post presentation has to be done in the MDMS institutes. There will be less professionalism in the MDMS government colleges, whereas more professionalism you will see in the DNB institutes. There will be very good passing rate in the MDMS colleges, whereas a very low passing rate in the DNB institutes. Then there will be exam will be conducted by the state universities in the MDMS colleges, whereas exam to be conducted in DNB by NBE. Okay, in on OSCE method. Then there will be more priority given to MDMS if when you go to the job, whereas less priority will be given to DNB. Comparatively, there will be less hands-on in the DNB as compared to the government institutes, medical colleges for MS MDs. Okay, now this is talk about ideal preferences. Let's say a dream branch. Okay, now here DB means a dream branch. Let's say my dream branch is general medicine. Okay, now if my I want general medicine and I get general medicine, my dream branch in GMC Chandigarh. So, and I am getting general medicine in I say Medanta. Okay, which is a very good DNB institute. I say very good DNB institute, but I have to choose GMC Chandigarh MD General Medicine over DNB General Medicine of Medanta. Then, if I'm getting general medicine, I'm not getting general medicine in MD general medicine in Chandigarh, but I'm getting general medicine DNB in Medanta, or I'm getting MD pediatrics in I say Chandigarh, but my dream branch is general medicine. Then I should go for DNB general medicine in Medanta over MD pediatrics in Chandigarh. Then if I'm getting MD pediatrics in Chandigarh, I'm not getting DNB medicine in Medanta, but I'm getting MD pediatrics in Sri Gangaram. So it's up to me, but I say you should choose MD pediatrics in GMC Chandigarh over, I say, DNB pediatrics in Sri Gangaram. Okay, so this is how you should choose. If you are taking your dream branch in MD, go for it. If you are losing your dream branch in MD but taking your dream branch in DNB, go for it. Choose wisely your DNB institutes, of course, but go for it. And if you are getting no, if you are not getting your dream branch but you are getting another branch which is good enough for you in MD, then go for it. Okay, instead of going for DNB for the same branch. Okay, now this is just a preference, ideal preference thing. I'm totally uh, giving an example here. So I think that's all. MDMS versus DNB thing. Both are good branches if you know the skills. Okay, that's what I'm going to say at last. If it doesn't matter whether you have done your general medicine MD or DNB, you have to treat the patients at your best. Okay, so let's see. Okay, I think that's all with this video. Thank you.